There's nothing more frustrating and disabling than low back pain. Are you at risk? Stay tuned. Find out when I go over my top 3 risk factors for low back pain, including a self-check for each. Watch to the end of the video and see what this crying baby has in common with your low back pain. What's up everybody, Tim Rementer, Doctor of Physical Therapy and Orthopedic Specialist. Before we get into things, please like the video if it helps you out, subscribe to the channel and turn on notifications so you never miss a future video, unless of course you like the idea of people getting unnecessary surgeries. Okay, to start off, low back pain is not a diagnosis, it's a symptom that's a sign of something underlying causing the problem. Taking one step further, when we see people come into the clinic with diagnoses of herniated discs, low back pain, degenerative disc disease, they all have one thing in common: flawed movement. Remember, this is not a substitute for actual evaluation or treatment. If you're feeling any discomfort or difficulties when we go through the top 3 activities and self-checks, please reach out to your movement specialist. Okay, let's get right into our top 3. Number 1, your spine segments are simply moving too much. This can of course be due to genetics. We all had people in gym class that were just more flexible than the rest. They tend to have ligaments that stretch out. They need a little bit more work on strengthening and stability. In a lot of cases, we see situations where the spinal muscles just are not controlling the vertebrae like they should. They're often related to disuse, atrophy, basically acquired weakness. Sometimes it can be due to muscles that are tight on the opposite side of the body, like the abdominal muscles or the hip flexors. Okay, let's get into our self-check number 1. What we're going to look at here is to see how your low back muscles are firing, to see if they're firing the way they should. So if you just pull up your shirt and feel your lower back muscles, as you take a step on your left foot, lift your right foot, you should feel the right back muscles tighten up, the left side relax. When you step on the right side, you should feel the left side tighten and the right relax. If you're feeling them not tightening up, if you're feeling them not relaxing, they're both problems. In situations where things are not tightening up, then we know we have a muscle that's not doing its job and it can lead to the problem we're describing here. Okay, let's move on to problem number 2, which is the exact opposite of problem number 1. That being, your spinal segments are not moving enough. With the rise of sedentary jobs, adaptive stiffness occurs. This can happen due to shortening of your abdominal muscles, your hip flexors, or just stiffening of your thoracic spine, low back, hips, and pelvis. I want you to think about your diet and nutrition. Say you had a bad weekend for your nutrition, eating a bunch of dips at a party, chicken wings, you drank a bunch of beer. You try to right the ship by shoring up your nutrition the following week, making healthier choices. We should take the same approach when it comes to our body, but instead we hop in our vehicles after a sedentary day at the office, 8 to 12 hours, drive home, hop on the couch, Netflix and chill. Our spines don't like this, nor should you. 5 minutes of simple stretching, or what I prefer, micro stretching throughout the day for 30 seconds on regular intervals, is just like giving your body nutritious foods, only for your joints and your muscles. Stay tuned to future videos where we'll go over different stretches and techniques you can do to address these shortened tissues. Okay, here's our self-check for risk factor number 2, your spine segments are not moving enough. What I want you to do is put your heels against the wall, butt against the wall, shoulder blades and head. You're going to keep your elbows straight and try to bring your arms overhead all the way back to the wall and see if you can touch. If you're not able to do this, you know this is an area you need to work on. You can track your progress by simply holding a ruler in your hand and marking how close to the wall you can get each week. You could use something like a paper towel, cardboard centerpiece, and mark off on that as well. You might be wondering why lifting your arms has something to do with your lower back. Our spine thoracic spine impacts both our lower back, our neck, and our shoulders because it's the centerpiece of the spine. So if it's not moving correctly, it's going to be a problem for multiple areas. Okay, this brings us to our final risk factor. Basically, you're out of control. You have all this movement available in your body, but you're not using the appropriate muscles to coordinate it. Typically, we see this as weakness of the posterior chain. Most of what we're doing throughout the day is in front of us, so we're really good at using our chest and shoulders, abdominal to a certain extent, but we really neglect our gluteals, hamstrings, and back extender muscles, what we refer to as a group called the posterior chain. This can be an acquired weakness, as is often the case, or a counter weakness due to tightness of the hip flexors and abdominals on the front of the body. Okay, so here's our self-check for problem number 3. We're going to see how well you can activate your hamstrings, glutes, and back extensors by doing a hip hinge to the wall. So I have some painter's tape on the floor and a tape measure. You can use one, the other, or both to see your starting point and to track your progress. I just start about 12 inches away from the wall, tap my butt, think like the wall's eggshells. You want to touch the eggshell, not crack it. Okay, and I go out about as far as I can, which for me is about 26 inches or so. I'll track that and see if I can extend it a little bit. Write yours in the comment below, as well as any progress you're able to make. And I'm not even going to talk about smoking when it comes to low back pain. Don't do it. It robs your body of oxygen. So there you have it, guys. The top 3 movement-related low back pain risk factors. But before we sign off, let's get back to our baby. Picture this. You've been home for about 1 month after delivering your firstborn child. You think you're getting the hang of it, and even think you might know what's behind each of their cries. Why is this important? Because you want to know what's driving their cries. Hungry? Food. Tired? Bed. Dirty diaper? You get the idea. If we just wanted to stop the baby from crying, we could stick a muzzle in its mouth. Of course, this is ridiculous, and nobody would ever do such a thing. But this is exactly what we're doing every day when millions of people take pain medications and injections to stop the crying tissue from making noise in their body, rather than addressing the underlying movement issue. Word of caution, even if you're a big fan of pain medications and injections, don't muzzle your baby, people. If you don't change the problem source, you won't change the problem's outcome. And considering musculoskeletal conditions cost more in our country than the cost to treat all cancers combined, we have to do something, and right now. Remember, next time you have a muscle spasm in your back or stiffness, that it's related to your movement. If you're not feeling your best, you've got to connect with a movement specialist. I don't care if you're seeing a physical therapist, physician, NP, PA, or chiropractor, as long as they're a movement specialist and they can get you back to feeling your best. That being said, physical therapists are uniquely trained in the musculoskeletal system and the science of human movement, and are best suited to treat these conditions. Join the movement by liking, subscribing, and turning on notifications so you never miss a future video. Remember, if you want to feel, perform, and live your best, you've got to move your best. Keep it moving.